Do you know that more than 26 million people around the world are living with heart valve diseases? And it is estimated that 1 in every 100 people over the age of 75 has a significant heart valve disease. For most people, as they get older, there is a higher chance that their heart valves start to narrow or leak. It is not uncommon to hear doctors use the terms aortic stenosis or aortic regurgitation when talking about heart valve problems, but these medical terms don't really mean much to most patients. So if your doctor has used these terms with you and you're unsure what they mean, make sure you watch this video all the way to the end so you understand exactly what is going on with your heart. Also, if you're new here, welcome. We bring you the latest research on how to protect and improve your health through nutrition and lifestyle. The 4 valves of your heart, the tricuspid, pulmonary, mitral, and aortic valves, make sure the blood flows in the right direction through your heart. When these valves become damaged or diseased, it's called a heart valve disease. Heart valve diseases are usually caused by underlying conditions like coronary artery disease, high blood pressure, or rheumatic fever. The most common types of heart valve diseases are aortic stenosis and aortic regurgitation, which can be caused by several factors such as age, previous infections, or congenital heart defects. Aortic stenosis occurs when the aortic valve becomes thickened and narrowed. This makes it harder for the heart to pump blood out to the rest of the body. Over time, this can cause chest pain, shortness of breath, and fatigue. Aortic regurgitation, on the other hand, occurs when the aortic valve doesn't close properly, allowing blood to flow back into the left ventricle. This can cause the heart to work harder than it should, leading to symptoms like heart palpitations, edema or swelling in the legs and ankles, and an irregular heartbeat. But early on, many people who are suffering from heart valve diseases may not experience any symptoms at all. That is why it is important to be aware of the early signs so you can seek medical help right away. Here are 6 early signs of heart valve disease that you can't ignore. Number 1. Shortness of breath. Shortness of breath is a very common symptom of heart valve disease, but it's not always easy to notice. It might come and go at first, or you might only feel it when you're doing something strenuous. However, as the condition progresses, you may begin to experience shortness of breath even when you're at rest. For example, you might find yourself struggling to catch your breath when climbing up a flight of stairs or walking up a hill. Or perhaps you wake up at night gasping for air. These are all warning signs that there may be a problem with your heart valves. The reason why shortness of breath happens is because the heart has to work harder than usual to pump blood through the narrowed valve. This puts extra strain on the heart, leading to feelings of breathlessness. Number 2. Swollen legs and ankles. Swelling in the legs and ankles is another telltale sign of heart valve disease. Here's how it works. When the valves in your heart aren't working properly, it makes the heart work harder. Over time, this extra effort can lead to fluid retention, especially in the lower extremities. This means that instead of circulating properly throughout the body, the fluid starts to pool in your legs and ankles, causing them to swell up. Number 3. Fatigue. Fatigue is a common symptom of heart valve disease. The heart has to work harder than usual to pump blood through the narrowed valve, which can make you feel tired and weak. Additionally, heart valve disease can cause the body to become less efficient at using oxygen, which can also contribute to feelings of exhaustion. If you are feeling fatigued all the time and haven't changed your activity level or made any other lifestyle changes, it could be a sign of heart valve disease. This type of fatigue isn't just a one-off feeling. It's persistent and can affect your daily life. Number 4. Chest pain. Chest pain is a hallmark symptom of heart valve disease, particularly aortic stenosis. It is the result of the heart working harder than usual to try to pump blood through a narrowed valve. This extra effort requires more energy, leading to increased oxygen demand in the heart muscle. When the heart doesn't get enough oxygen, it can trigger chest pain. However, it's important to note that not everyone with heart valve disease will experience chest pain. Some people may have no symptoms at all, which is why regular checkups are so important, especially as we get older. Number 5. Rapid or irregular heartbeat. When the heart has to work harder than normal, as is the case with heart valve disease, it can sometimes try to compensate by beating faster. This is known as tachycardia. An irregular heartbeat can also occur as a result of heart valve disease. This is known as arrhythmia. Both of these can be serious complications of heart valve disease, and it is important to seek medical attention if you experience either of them. A rapid or irregular heartbeat may feel like a sudden fluttering or pounding in your chest. You may also feel dizzy or lightheaded when it happens. And number 6. Cyanosis. Cyanosis is a bluish discoloration of the skin that occurs when there isn't enough oxygen in the blood. It's a well-known sign of heart valve disease, particularly when the blood flow is blocked or restricted, such as in the case of aortic stenosis. The most common places for cyanosis to show up are the lips, gums, nail beds, and palms. In people with fair skin, this bluish tint may be easier to spot. However, it's important to remember that cyanosis can also occur in people with darker skin tones. In these cases, you may need to check the palms, soles of the feet, or conjunctiva of the eyes for a bluish hue. If you do notice this discoloration, it's important to seek medical attention right away. The bottom line, if you're experiencing any of these symptoms, don't hesitate to talk to your healthcare provider. They can assess your individual risk factors and determine the best course of action. Remember, it's always better to err on the side of caution when it comes to your health. Many people think of heart valve disease as something that only affects older adults, but the truth is anyone can develop this condition regardless of age. While some valve problems are present at birth, others develop over time as a complication of other health issues. For instance, if you've been diagnosed with coronary artery disease, high blood pressure, or diabetes, you may be at an increased risk for developing heart valve disease. Fortunately, there are steps you can take to reduce your risk and protect your heart valves. First and foremost, it's important to maintain a healthy lifestyle. Eat a balanced diet low in saturated and trans fats, cholesterol, and sodium. Regular exercise, stress management, and adequate sleep are also essential for maintaining good heart health. Additionally, it's crucial to avoid smoking and excessive alcohol consumption, as these habits can put additional strain on the heart and valves. Regular checkups with your doctor are also essential, especially as you get older. This will allow them to monitor your heart health and catch any potential problems early on. Now that you know the early signs of heart valve disease and how to prevent it, take charge of your health today and make positive changes that will benefit you in the long run. Don't forget to share this video with your loved ones and stay tuned for more informative content. Thank you for watching and see you in our next video.